Hi everyone. I thought I'll just quickly sum up a quick health advice guidance for anyone who is planning to travel in the near future. Travel either locally or going abroad. This is mainly if you're planning to go abroad. Number one thing is a prep. So do your research to see which country you are planning to visit and go to their government website and then see whether there are any restrictions on medications, on clothing, or on areas that you can and cannot go, and find that out. And if you have a destination planned, also contact your GP to make sure that you are protected. So if you're visiting, for example, a country where malaria is quite spreading, then you will need malaria prophylaxis, and you need to do this well in advance, at least 1.5 months before the travel. So you need to contact your GP as soon as you decide where you're going to find out whether there are any health precautions that you need to do or take, get vaccinations or start on any medications prophylaxis to be ready in case you have to face any untoward health problems. Rabies is one of them, malaria is one. So there are vaccinations, there are medications that you can take as protection. Number two, go to your local chemist and then make sure that you have things that you can get over the counter, painkillers, and anti-sickness medication if it is travel sickness or food related sickness, and also anti-diarrhea medication. There's medication that you can get, loperamide for example, from over the counter. And also make sure that you plan ahead. So if you're already on medications for any condition, long-term conditions, make sure that you have enough medication to last for the time that you are away. I work for the NHS 111, and on weekends I get people coming through asking for prescriptions because they're planning to go on a holiday. They say, I'm planning to fly tomorrow, but I don't have enough medications to last. So prescribing something from our service is not the issue. Issue is if you're coming along, for example, on a Sunday, there will be no pharmacies open for you to get the medication out from. So even if I give you a prescription, you can't get them anywhere because the pharmacies will be closed. So do that well in advance, at least 2-3 weeks before you are flying. Okay. And throughout the journey, make sure that you wear compression stockings to prevent any blood clotting. And they travel everywhere if they form, and they can cause problems. Sometimes you can even lose life if you have something called pulmonary embolism, end up in your heart, lung, or brain. That can be very dangerous. And also in your packing, make sure that you have enough sun cream. Don't expose yourself too much to very hot sun for too long, and make sure you are well hydrated. If it is a long haul flight, make sure you're drinking plenty of fluids, water preferably, because alcohol and caffeine actually dehydrates you. So it takes the water out of your system, not giving you any fluids. So to compensate, you need to drink water, natural juices or something like that, and keep on top of it. If you're driving long distance, then you can have pit stops and have a good stretch, little walk. If you're on a flight, of course you can't, but get up from your seat every couple of hours if possible and move around a little bit. Okay, that is just to encourage the blood flow. Once you're in the destination, make sure you do your research and find out that there is a health service that you can go to in case of an emergency, anywhere that you can quickly drop in. So find that out rather than facing the problem and then rushing to see, oh, where can I go for help? Do your research about what their emergency services are like. Is there ambulance service you can call, and if so, what is the number? So those things, just make sure that they are all available and you know where to go, who to call, what numbers to call, before you encounter any problems. And in terms of packing up, actually, I forgot to mention, make sure that you have anti-allergy medication as well. If there's any allergic reaction, you want some antihistamines. Again, there are various options available in pharmacies you can buy over the counter. And health insurance, extremely important. We have seen patients actually who didn't have health insurance and they didn't have enough money, so they wait and come all the way to UK to get treatment. Sometimes it is too late if they encounter any sickness or any health problems whilst they were abroad. Then sometimes things are little too late. We can't treat them. Sometimes they end up having long-term conditions that they will live with for the rest of their life as a result, because they didn't get the help at the right time. So make sure you have a good health insurance. Make sure you read the terms and conditions, that it covers all areas, emergencies especially. They don't have small restrictions on how much they're willing to spend. And when you do buy health insurance, make sure that you declare all your existing problems. Otherwise, if there is a problem, they will find a loophole not to pay you out. Okay? So be very transparent, because they can find that information that is not hidden. All right? And have a good health insurance. Yes. So whilst you're away, make sure you keep well hydrated, stay in the shade wherever possible. If you go into hot sun, hot sea, make sure that you just keep taking breaks to go into the shade and drink some water and stay well hydrated. All right. And when you come back, if you start feeling not very well, then you need to contact your GP and get some advice, and then save the destination where you have been. Some mild symptoms can be masking bigger things like malaria, for example, or typhoid. You might think it is just a tummy upset, or it's just a little fever, it'll go away, just a bit of temperature. But then it might be because of bigger things. So if you tell the GP where you have traveled to recently, that'll help us narrow down what potential risk that you are at. All right. And the elephant in the room is unprotected sex. If you happen to encounter any of that whilst you're on holidays, please make sure that you go to and treat it as an emergency as soon as possible, within 24 hours of the incident. No later than that, you need to access healthcare and then ask for an emergency pack for any potential infections, sexually transmitted infections, STIs, and also any potential risk of unwanted pregnancy. So there are morning after pills and things available. So you need to access healthcare. Don't delay, don't leave until you come back to your country to get treated or to get checked. It will be too late sometimes. So you can just go and get these medication packs which can help and treat for potential risks. And that is what I wanted to share with you. If you're thinking of traveling, think of health as well, because these are very easily preventable, easy to look after. But if you don't take precautions and spend that few minutes of preparation, you can end up with bigger problems. And we don't want that. That's the last thing you want, and the least thing to worry about when you're having a holiday or going somewhere. Okay, stay safe everyone. Have a good journey. Safe journey. Bye-bye.